So people will often talk about in the early days, the golden hour. And I'm just going to rephrase that. It's not a golden hour. It's a golden moment, okay? Because what's actually going to happen is that baby's going to be placed on your chest. They should be placed on your chest after you've given birth. No weighing, no washing, you know, unless they're really unwell, fair enough. But otherwise, they should be placed on your chest and you should be having that skin to skin, uninterrupted. No one coming in, no one prodding, poking, anything. Uninterrupted, you and baby with your chest, okay? Just there. Now, babies have this really fascinating skill. They can actually crawl at birth. Now you're thinking, no, they can't. Well, it's not crawling as in crawling across the floor. It's this kind of shuffly movement that they do, that they can go from your tummy and they can get all the way over to your breast. Don't believe me? Have a little look on YouTube. There's loads of fantastic newborn crawls, okay? So with that newborn crawl, they're not crawling around like they would on the floor. They're using a step-in reflex, and that step-in, they're going to kind of push with their feet along your abdomen to get to that breast. Now that'll take quite a bit of time. You know, they'll come out, they'll be placed on your chest, and they might lie there asleep for a little while. They'll then kind of wake, and that's usually within the sort of first 30 minutes. Might start smacking the lips. That's kind of one of those early feeding cues that you'll come to learn, licking their lips. And then what they'll do is they'll do that kind of pushing, and they'll push, push, push until they get to your breast. Now they're using kind of their scent. So your amniotic fluids smell like your breast milk. Isn't that fantastic? It's just amazing. So that's how they know how to get where they need to go. And when they get there, they might do a little bit of head bobbing. They might rest again. And then they'll do a big mouth and they'll latch. That process generally is within the hour. However, there's a lot of variables. You know, if you've had certain medications, your baby might be slightly more sleepy. It might take them a little bit longer to do that. So this is why I don't like the term the golden hour, but more the golden moment, because it's a moment with you and your baby until they've had that first feed, and you don't want anyone interrupting, because what the research says is if you allow your baby to do that newborn crawl and they latch and then you have that whole time uninterrupted from birth, they are more likely to be successful in breastfeeding. You're less likely to have any issues, any pain. It's all in research, but we do get rushed through the maternity system, and sometimes you just need yourself, if you can, or your birthing partner, to just advocate and say, stop. This is me and my baby. We are having our golden moment. You can weigh them, you can do whatever after they've had their first feed. No cleaning, no nappy changes, nothing at all. Just until they've had that first feed, you and baby getting used to each other. It's so special.